How are you?
I'm doing good.
So, what brings you into my office today?
I've been experiencing some chest pain and I don't know what the problem is.
Do you have any sort of other symptoms along with the chest pain?
I have been experiencing a racing heart and some fatigue.
Oh, well, that's pretty serious. So, I'm just going to ask you a couple of questions so we can kind of figure out what's happening. So, if you could tell me, when exactly did this pain start?
About a week now.
Oh, it's been going on for a week. So, how's your sleeping cycle? Is your sleeping cycle normal? Is it has it changed up or anything?
To be honest, it's pretty normal.
Okay. Have you been experiencing any sort of dizziness lately? Any sort of lightheadedness? Anything of that?
Sometimes I feel slightly dizzy.
Okay. Have you been nauseous lately, like throwing up?
No, not really.
Okay, so if you had to be honest, from 1 to 10, how strong is this chest pain?
I'd say about a 7.
That's pretty strong pain. Are you experiencing any sort of throat ache, throat pains along with this?
No.
Okay, and how about nasal congestion, anything like that?
Not at all.
Okay, that's good to hear. Besides the chest pain, are you experiencing any other kind of pain? Like headaches, bodily pain, anything of that?
No.
Okay. And diet-wise, do you include a lot of caffeine in your diet?
No.
Okay, that's really good to hear. How about sugars? Do you have a lot of sugar as a part of your diet?
I can't stay away from that.
That's a problem. See, a lot of consumption of sugar, it could lead to a lot of clots in the heart, your blood vessels getting clogged up, a lot of that. So we might have to check that out. Now there are 2 ways we can check that out, and 2 ways. One of them being that you could get an x-ray, and you know all about x-rays, they're pretty normal. All you have to do is just lie down and we'll just pass the machine over you, take a few pictures, and then we'll take a look at them. Or you could do what I would suggest for you to do, which is a fluoroscopy, and that would mean we would be passing a machine over you that would give us a live video of what exactly is happening in your heart.
What is a fluoroscopy?
A fluoroscopy is basically an exam provided by a fluoroscope machine. It's kind of like a live x-ray. You would have to lay down just like any normal x-ray, and we would pass a machine over you that would basically see through your flesh.
Does it hurt?
No, not at all. It's just like a normal x-ray.
Okay, is there any risks that come along with this?
Well, there are some risks to this procedure. Radiation-induced injuries to the skin, which occur shortly after the exposure, and radiation-induced cancers, which may occur sometime later in life. The probability that a person will experience these effects from a fluoroscopic procedure is statistically very small. Therefore, if the procedure is medically needed, the radiation risks are outweighed by the benefit to the patient. If you are pregnant, which I can assume you aren't, it will affect the child. And if you are allergic to radiation, then you will also have a reaction, which could be from something small to something or to a really bad reaction.
Well, I'm not allergic to radiation at all, so no worries about that.
Okay. Now, if you have any more questions or you're more concerned about the whole radiation process and everything, there's this video I could suggest to you, and it's called All About Fluoroscopy. I will send you the link via email, and you would be able to check out exactly what a fluoroscopic procedure is.
Okay, thank you, doctor. I'll be sure to check that out.
Yes, definitely, anytime. And once you book your fluoroscopic procedure, I will be more than happy to take it for you, and so we can figure out exactly what is happening inside your heart.
Okay, thank you.
You're welcome. Bye-bye now.
Bye.